time, I think senators need to get on that as soon as they can. I'd like to call the meeting to order. This is the Local Affairs Subcommittee on S2. That's us all. Welcome, everyone. First up is Commissioner Hugh Weathers on agriculture. Mr. Weathers, how do you do, sir?
Good morning, Mr. President. Senators. The green light is on, so.
Good night, sir. Good morning.
Thank you and good morning. We're here to share with you some of our thoughts about the amended version of S2 and primarily answer your questions that you have. And if they're beyond very simple, I have staff with me to do that. Their collective job is to make the commissioner look reasonably intelligent, so it's a big challenge.
I say it is, our job.
But based on the discussions we've had with legislative leadership, our internal discussions, and some other ways that we see services can be delivered to South Carolinians as effectively, if not better, going forward under more findings of efficiencies. What we have with the programs that we see very much in our wheelhouse, I think you have a chart with those on there. If not, it is in the listed here in the amended S2. A lot of these fall right within what we're already doing on our Consumer Protection Division. Most of them are all related to food. We feel very strongly about our ability to deliver services around food regulations, about people's food safety, and about the fair trade, if you will, regarding that. This has come about through the last several years of our engagement with federal authorities under a law passed in 2011, I think, that has been developed through regulations over the years. That's the Food Safety Modernization Act. And basically what it did is elevated a lot of our responsibilities from farm all the way, primarily at the farm, but through manufacturing and otherwise. We have overseen food manufacturing in South Carolina by our South Carolina operators for a number of years. With adding on things like the retail food inspection, it is a natural extension of that. Our personnel across the state are based at home, and we've equipped them with up-to-date technology so that the efficiencies that we think will come are based on our ability to cover the territories and disciplines of food production required without a lot of additional overhead costs. We'll have the frontline costs. We'll have to evaluate personnel needs with the extra disciplines, but we have always believed in and put more emphasis the last few years on cross-training. No matter whether a person's checking a scale at a grocery outlet or actually gathering a sample of food to take into our residue labs, our personnel, again, are very much involved in being cross-trained. So here, some of these responsibilities, that cross-training will serve us well, and we'll add those on. So that is, I'll not say it covers retail, but that is how we see addressing retail. Then we move into milk. We have worked with DHEC over a number of years, making certain that our responsibilities have never overlapped and our investments have never overlapped. So again, we feel quite confident in bringing back some of the things we did previously that we assigned to DHEC because of the efficiencies, but bringing them back, they fit in just like some of the other food responsibilities. One that moves a little bit out of food, I suppose, is water and the ice and the soft drink. But again, the format of how we approach our inspection work, these fall right into that same structure. So new discipline, but same manner of managing it. The home-based foods, again, we do have responsibilities that we make certain that ours don't overlap with DHEC over the years. So again, it's bringing more of that back. We know that some restructuring will be required of our Consumer Protection Division without a lot of top costs, just down on the line. But again, for the sakes of efficiencies, spreading the org chart around a little bit. And we've already, I think second page that we gave you addresses that. So that's some of the beauties of the efficiencies we're talking about. Shellfish, we already have some responsibilities with bin fish and other things like that. But in order to do those, we do see some additions necessary. If in fact all that occurs on the coast and send, we don't want to be bringing those water samples all the way back to Columbia. We think that there can be a better way to do it than that. All of our other samples that we've talked about, our laboratory facilities at the farmers market, the footprint of the building and the laboratories are there and sufficient to take these on. We have already begun retrofitting some of our laboratories, not for this, not for S2, but for some of these other responsibilities that we've had come in the last 4 or 5 years. So the structures are there, literally, building structures. It's just a matter of some equipment upgrade, so retrofitting those. But the seafood, shellfish from the coast, perhaps a little different. Again, we've talked about laboratories, but some of our projects or some of our disciplines, responsibilities we bring on will require some software updates, things that manage laboratories and allow all of these responsibilities to talk to each other efficiently on the same platform. So we know that other than our organization chart restructuring, other than adding those frontline personnel, some of the equipment we've talked about in retrofitting and this software, those are some of the costs we see involved in making this transition. Again, we think it plays to the strengths of the Department of Agriculture. I will tell you this, in the last few years, we have assumed responsibilities of some other statewide food management programs. Again, a federal-based program called the Emergency Food Action Program, Assistance Program, TFAP. And we assumed that responsibility from another state agency and are delivering that by way of the food banks across the state much more effectively. And we found that out during COVID, quite apparent that we're doing a good job using 1/2 of an FTE where there had been 2 FTEs assigned previously. My point is the Department of Agriculture is well managed, lean in its operations and overhead, and we think that these 6 responsibilities fit into our wheelhouse of what we're well equipped to do. And with that, Mr. Chairman, I don't want to ramble on too long, but I've told you what I came to tell you, so I'll stop and hear what y'all have to ask.
Good, thank you, Commissioner Weathers. The original S2 version had a great deal of environmental responsibilities placed within the Department of Agriculture, and the subcommittee amended the original bill creating the Department of Environmental Services, placed a lot of that responsibility within the Department of Environmental Services. Are you okay with the changes? Do you agree with what we did?
We are, because of my remarks that said these food responsibilities play to the strength of the Department of Agriculture. Even in these, we have a philosophy of educate first and regulate. That might be a little more of a challenge in some of the other areas that were originally coming to the Department of Agriculture to work with the farmers and then regulate them with one hand and the other. We do that now with food, but it's more easily accomplished with food than it would be in some of the areas in the original bill.
Members have any questions or comments? Senator Alexander.
Good to see you this morning, Questions. Don't you also already, you do meat inspections and processing, or y'all have some partnership from that standpoint, or what is?
Clemson University, not the livestock and poultry health, but they handle the meat inspections of the smaller operators in the state, and then when we get above a certain size, it's USDA.
USDA. not necessarily. Do you see an ability with moving these different areas to your agency to have, you mentioned economy of scales and lean and things of that nature, to have the ability to, would you cross-train folks so that if you got somebody going doing scales in the grocery stores, as you mentioned, to have the ability to go ahead and do the food, to kind of do a full service recognition rather than having 3 or 4 different people come in there to take a look at it?
Yes, sir, we've done it geography-based, territory-based, with the personnel in the field cross-trained with a assignment of, let's say, a few counties, so that they don't have to travel as far. They can communicate everything electronically until they physically bring in the samples. But adding these other disciplines is just additional cross-training. We may have to shrink those territories as they take on more. They couldn't go as far and accomplish everything. So that's where we see the investments would have to be made out on the front line.
It'd still be one individual. Hopefully, in most cases, one individual taking care of everything.
We are big believers in cross-training.
Thank you. Thank you, Mr. President.
Senator Clinton.
Morning. Venison processors, they're gonna be under you if we went forward with this, or would they?
No, that still is under the meat inspection.
Under meat inspection, right, okay. How about, on a different matter, we're talking about moving all the water, to one place. I'm not asking for the Department of Agriculture, what do the farmers think about that?
I think the farmers want to have one go-to agency about water, and knowing how critical it is, not only for this year, next year, but the next decade. So I think the one agency concept is attractive. I've talked to enough farmers to have that opinion, and I believe that as well. So I think the one agency is a good strategy.
Okay, thank you.
No. Thank you, Commissioner.
Thank you all.
Next, Department of Alcohol and Other Drug Abuse Services.
Good morning.
Morning.
Senator Taylor, members of the committee, grateful for the opportunity to be here. I just want to start by saying that I really appreciate, Senators, your close examination and consideration of how our state health agencies are structured. It makes good sense to explore the alignment of state agency functions so that we know we're leveraging our assets. You know that federal, state, and local public health agencies work tirelessly and often in the background to prevent disease and educate the public, to set safety standards, and to address complex population health issues. Aside from COVID-19, we have a number of ongoing and emerging health issues and concerns to monitor and respond to, including other infectious disease and issues like maternal and child health, obesity and food insecurity, injury, violence, and suicide. We have chronic diseases like cancer and diabetes to address, as well as conditions like mental and substance use disorders. The Department of Alcohol and Other Drug Abuse Services is a public health agency that addresses a special health issue with a unique set of needs. In the past, the General Assembly took a perspective that government's role with alcohol and drug services warranted independence and chose to draft policy that kept its functions uniquely situated. There may have been many reasons for that policy. I listened to this committee's conversation last week about elevating the visibility of water issues and consolidating them into one agency. I can say that the autonomy to engage the public eye and shine a spotlight on issues has certainly been a benefit to preventing and addressing alcohol and drug issues in our state. Mental and substance use issues can be uncomfortable to look at, and they can be hard to talk about. So any restructuring should be careful not to put them out of sight and out of mind, particularly when collectively we have a lot of work ahead of us to serve families and communities that are hurting. And we have a collective responsibility to diffuse the shame and the stigma associated with these issues. So every state has a state alcohol and drug agency, or what is known as a single state agency, an SSA. And there's variation on how they're structured across states, but they all have similar roles. And primarily, DAODAS is a payer. We manage the substance abuse prevention and treatment block grant funds and substance-specific grants for the state. So we're paying for clinical and medical services for our citizens who cannot afford them. We also pay for and assist in the development of programs and projects and services across the continuum of prevention, intervention, treatment, and recovery. So our role is to ensure effectiveness through planning, oversight, and accountability. Our role is to promote and ensure quality in practices and programs so that government funds are maximized. To get this done, we support important relationships with the provider community. And we really have connective tissue between us and the county alcohol and drug authorities, the opioid treatment programs, and the recovery community organizations, because they're the ones delivering the direct services with the proximity to understand the local dynamics and the local needs that we strive to support. But together, we're a mission-driven system. And so finally, our role is to promote coordination across state government, and DAODAS certainly coordinates, collaborates, and communicates with DHEC on a daily basis. We also do this with the Department of Corrections, the Department of Mental Health, the Department of Social Services, and SLED. And we partner on projects with the Department of Veterans Affairs and Triple P. The impacts of substance use and mental disorders come up everywhere, so it's essential that we connect to address them together. Our state health agencies are backbones for life-saving services and programs. With the pandemic and the drug crisis and the recent heightening of mental health needs, we cannot afford a lapse in performance, as you know. And so should restructuring occur, I hope that a measured approach can be taken to ensure continuity in what we do to serve the public. The benefit of being a smaller and separate agency is that DAODAS is agile. We're currently able to work quickly, whether that's developing a new contract or issuing payments or developing a new program. Our partners and stakeholders aren't typically waiting on us. The benefit of combining agencies, as S2 proposes, would be to increase our greatest asset. And I believe that our very best assets in state government are our staff. Consolidation means to make stronger, not to make smaller. So last, I'll just say that the language influences people's view on substance use disorders, and it can influence the care that people seek and receive. And so we would be happy to offer current terminology for this bill to replace outdated terms like abuse, addict, and alcoholism. These were drafted into the former enabling legislation. Also, we were engaged with House legislative oversight last year, and there we discussed the need to modify the language in that enabling legislation to more accurately reflect the agency's current functions. So we're happy to assist with that language as well. And one last thing, I just want to say the Substance Abuse and Mental Health Services Administration, our federal counterpart, supported a study that's been recurring over the last decade or more that really looks at mergers of state substance abuse agencies with other government agencies. And the independent researchers looked at impact to services, policy, budget, and performance. They most recently updated this past December in the context of COVID-19. So we're happy to share this electronically with you if you're interested. And I'm happy to answer any questions.
Ma'am, Mr. Santota.
So, did you say that all the other states have their alcohol abuse services as a standalone?
No, sir. Just every state has an alcohol and drug agency, and where that's structured in government varies state to state.
Okay, so whether it's called a department or whether it's called a division, is that just a matter of semantics, or is that in any way meaningful in terms of how you either are perceived or how you deliver your services?
The role and the functions, no matter where it's situated in state government, are the same, and those are what I described. So it could be inside of an agency or independent, depending on the state, but the core functions of the agency are consistent across states.
Okay, so there's nothing about you being embedded within a department and changing your status from department to division that would impede you from delivering your accomplishing your mission.
No, sir.
Okay, thank you.
Questions, comments? Sam.
Thank you. I heard you mention that you've been working closely with SLED. I'm wondering, I just haven't seen anything from SLED to other police agencies when situations arise. And I'll give you, for instance, in Charleston recently, we had to pick up a gentleman who was quite violent at a private mental health facility, and they wanted him arrested because he was beating up staff and beating up other people. They didn't know where else to take him except for to jail. So what kind of communication is there to regular police agencies so that they maybe can choose another path besides jail for mentally ill?
Senator, that's a great question, and I have a lot of concern for those individuals, but I can't speak on behalf of SLED and what they do with individuals who are experiencing mental health crisis. I can say that, we're in touch with SLED daily on issues related to availability of illicit substances and how those are trafficked and available through our states.
Okay, well then if it's not SLED, who do you work with to basically help other law enforcement agencies find placement for folks like this? Because we get criticized, he's mentally ill, you should know, you don't treat him like a prisoner, you're not supposed to handcuff him, you're not supposed to, even wear a uniform around them, you're supposed to call them by their first name. There are all these different things that apply to mentally ill, but yet when police officers find them in the field, what do? Where are they supposed to take them? Who handles that aspect?
Senator, I can't answer with confidence, but to the best of my knowledge, I believe that the Department of Mental Health and their crisis services, community crisis services, often work with law enforcement locally to address those individuals.
And do you work with DMH, I guess? I mean, aren't we trying to bring things kind of under one umbrella where it makes sense?
We are looking at that with this bill and what this bill proposes, Senator. I'm with the Department of Alcohol and Other Drug Abuse Services, so we really do focus more to the alcohol and drug side of things and how substance use disorders impact the individuals you're speaking of.
Thank you.
What else? Thanks, ma'am.
Thank you.
Next, Department of Veterans Affairs. Morning, sir.
Good morning, sir. Senators, thank you very much for the opportunity to be here today. Those of you who don't remember, I'm Will Grimsley. I'm Secretary of Veterans Affairs, about 14 months into this position and continuing to move on. S2, for our piece of this, on the surface, looks to be relatively simple. It's a veterans nursing home from the Department of Mental Health underneath the Department of Veterans Affairs. And so from that aspect, it is relatively simple. When you look at it from my perspective, though, as a brand new department still trying to stand up, there are some complexities here. So I appreciate the opportunity to share that and just lay this out for you. I believe you know this, that South Carolina is the only state, to my knowledge, or territory where the state veteran nursing homes are not under the control of the Veterans Affairs or Veterans Services or whatever the commission is. Every state and territory has something like our department, you just heard data speak, but they are all very different in where they reside and how they do business. But the veteran nursing homes are pretty consistent, except in South Carolina. They've been under the Department of Mental Health, as you heard Dr. Rogers say last Wednesday, and for a variety of reasons. But so the logic of this proposed transfer from the Department of Mental Health to the South Carolina Department of Veterans Affairs is perfectly clear. And we in the department stand prepared to assume this responsibility if directed. So I'd just like to lay that out front. There are, however, some pretty significant additional considerations not specifically listed in the fiscal impact statement or other documents worth highlighting, and I'd like to go over those very briefly for you. The Department of Mental Health currently provides a very high quality of service in our veteran nursing homes, and every effort must be made to ensure that that quality of service is not diminished, even temporarily, on the execution of any potential transfer to us in the Department of Veterans Affairs. I think that's the guiding principle of this whole thing. For the 516 or 20 or so veterans we have currently, soon to be about 700 and eventually over 1,000, that level of service can't diminish. That's the standard we have to continue to uphold. But we as currently organized do not have the expertise in nursing home operations, and quite frankly, we lack several other necessary capabilities for effective execution in this critically important function. These capabilities include a legal department, finance and accounting office, nursing home oversight manned by licensed professionals, a human resources office, and an information technology office. None of those exist in the department as it currently stands. Justification for each of these needs are outlined, and I'll go over these very briefly. And I have a summary table that I'll provide to the committee that lays out by position and at least a generic level, baseline level of if you will, of cost associated with that over time. The first is the General Counsel and Legal Office. This proposal introduces a broad array of legal matters within both the medical and veteran fields in the daily operation of the department. The department currently has no legal capability. We rely on shared services for a lot of our work with the Department of Administration and others. A General Counsel, one FTE, was in our proposed budget. Thank you to the Senate for passing that. It's currently, as you know, over with the House. That would bring a general counsel on. We think there's probably at least one additional attorney and perhaps a paralegal that would help us with that. Finance and accounting is a big part of this in terms of both the budget management, which we also rely on shared services for, as well as the contract oversight and the billing that comes with the administration of veterans nursing homes and all costs associated with it. This would expand our budget fairly significantly. That's putting it mildly. We have no internal financial management, accounting, or billing capability. And as I said, we're currently dependent on the Department of Administration. If you take our existing FY 2021 budget, presume passage of the budget that the Senate has already passed and the House is now considering, if you add the S2 addition, it changes our budget by about almost 2,000% when it comes to contract administration and the oversight of the number of full-time equivalents. That's a pretty significant increase and well beyond what I believe we ought to burden the Department of Administration and Shared Services with. The third is contract management. 2 of the 3 current nursing homes operate under contracts, as you know. One home, Stone Pavilion, as you heard Dr. Rogers lay out last week in Columbia here, is part of a larger South Carolina Department of Mental Health facility with shared maintenance, food service, and other integrated support services that are very difficult, in fact, not impossible, but relatively infeasible to separate. A way to think about doing this differently, if we were to take on this responsibility, is create a potential contract opportunity or arrangement between us back to the Department of Mental Health to continue to administer that as a contract ability. Therefore, no diminution of services or change in the structure. It's just who's paying the bills and whose logo is on the front door, essentially. We have the ability to do that. Both the homes opening the summer of 2021 in your own districts, St. Gaffney and Florence, will operate under contracts. That contract has been awarded, and they're in the process now of upfitting and everything else on that. A 6th home is planned and already underway in terms of the planning and execution, likely also to operate under contract. There are 2 additional homes, likely bringing the total to 8 eventually, that we believe will be necessary to fill projected demand. And those are already in the works of at least the forecasting of and site identification. And I believe that the best way to do this is also to operate under contract of those as well. That's the most efficient way to do this. That's the way most of our counterparts in other states do this. And again, we manage very small contracts in our department right now. These are very large, complicated contracts. The next is inspection and oversight. So proper oversight of nursing homes requires expertise in physical and behavioral health, social work, care facility management, et cetera. In many cases, this requires licensed professionals. Certainly in the immediate oversight, the person potentially in our staff has to be a licensed nursing home administrator to be able to do this effectively. And by law, that's what the USDVA requires, the administration oversight of nursing homes. The project and construction management of future homes also requires expertise and experienced professionals. Retired Navy Captain Ken Roy over in the Department of Mental Health does this not just for nursing homes, but all of the other facilities that DMH manages and builds, not just for them, but for many others, to take care of all of our citizens. And he's retiring in 2022, as we understand it. They DMH have identified a prospective replacement also on their staff, and he's now in, for lack of a better term, an apprenticeship program. We would need that same level of expertise, potentially that same person, if we take this on. But to really carry that forward, this is a very well-recognized level of expertise in DMH right now across the state in a wide variety of sectors. And then lastly, a human resources office. If we grow the staff this way, depending on which way you look at it, just with the passage of the budget, we're going to double the staff into very necessary capabilities. And I mentioned some of them already, general counsels, public information. But there are some others in the integration phase of taking care of veterans across all the social determinants of health that grow in the staff. If S2 passes in the future, that will grow the staff additionally larger. And the ability to have human resources capability both for staffing and recruiting, but also for benefits administration and everything else that goes with HR. We think that's an important component to take away from the shared services. If I have to take a risk in one place, though, and continue to rely on shared services, this is where it would be. I think we could probably absorb that somehow. So the fiscal impact statement, as laid out, doesn't include the cost of these capabilities. But to estimate all these in terms of both staffing and cost, we looked at some of our counterparts in other states that are doing this similarly, as well as we've been in constant coordination with the Department of Mental Health, well, prior to the introduction of the bill, because they administer on behalf of our veterans. But also subsequent to the bill being entered, we also have been working to think through the problem set. If we were to do this, what does it look like and how do we do it? So we've given Department of Mental Health a draft manning staffing document for their review. They're helping us identify what gaps might exist in our proposal and where we might have some overlaps, where we can gain some efficiencies. And we've already identified potential by state pay band and where those levels of responsibility might lie. So we're working through all this right now, presuming that we will be asked to take this on. Mississippi is the closest southeastern state in terms of veteran size and number of veteran nursing homes that is most closely related to us. They have a department like we do, an Air Force, retired Air Force veteran is my counterpart there. They have 4 veteran nursing homes that they administer all under contract. And right now they have no plans to expand anymore, but they're constantly, like we are, looking at the veteran population, where they reside, et cetera. And so in many cases, their model has 2 inspection and oversight positions that require licensed professionals, a licensed nursing home administrator, and a licensed nurse. And they also have additional staff people. If you looked at what we have today, and what might come with the passage of the FY21-22 budget and the fill of certain positions, especially in public information and general counsel, and then take where their capabilities lie, this comes to about a floor level, about a $2 to $2.2 million increase for these additional capabilities that I already outlined. And so that comes most specifically in the addition of, again, finance and accounting, inspection and oversight, human resources, one additional public information. And one I didn't mention, but we rely again on shared services for information technology. We start talking about sophisticated billing and the ability to do more things electronically, what we're already doing with our own maintenance of website and social media and the significant amount of information technology we use for claims management and other things. Probably time to bring that over in-house in the Department of Veterans Affairs as well. And so that comes to an addition of about 19 full-time equivalents. If you take the 6 that are in the fiscal forecast, and then that comes to probably 13 or 14 additional FTEs. Add the additional space and other things, about $2.2 million as a floor that we would start building. As I said, we're in ongoing dialogue with DMH to really help us refine this better. There are resident experts here in the state, and we owe that back to you with much better refinement. So the bottom line, if we do choose to do this, we fully are prepared to do that. Obviously, it will have to be done somewhat incrementally. If you ask us to flip the light switch at some date, much like a military operation, because that's my background, if that's the objective, then I think we need to back off from that and start to identify all of the precursor requirements, both in alignment of resources, the identification of the right people, the recruiting, bringing them aboard, and training of them, and then the sort of the relief in place, if you will, of the Department of Mental Health, so that we make sure that expertise again is sustained throughout without a diminution of services. So I can't give you an accurate time frame on that. I would just respectfully ask that as we think about this, we can work from the objective backward and identify those things up front. So we don't want to rush. We don't want to rush into the wrong direction on this. So sort of subject to questions if you already have.
Sir, what's the source of funding? Is it 50-50, 50% state, 50 federal?
The bulk of the construction and construction, as well as the administration of the operations of it, it depends somewhat based on the nursing home itself. But the bottom line is it's roughly 50-50. Now, there is a per capita, or per diem rather, of resident that comes based on the nursing home. So currently in Walterboro, Anderson, and here in Columbia, we are working at one rate. DMH is raising the rate slightly. It's relatively small for each resident. But based on the level of service, the square footage, and assigned to each individual resident and other pieces, that per diem rate can change. The quality of care that was required by the U.S. Department of Veterans Affairs for the 2 new ones, the one in Gaffney and Florence, is significantly different in terms of square footage. They're single resident rooms, private bath. They're in a you've been to one in Gaffney, it's 4-plex, as you know. And so it is a significantly higher level of service, if you will, and certainly quality of facility. So their per diem rate is going to be higher. Now that's changing, as we understand it, from the Department of Veterans Affairs for the next ones, likely Sumter, O'Regan, somewhere down the Savannah River Basin, I think.
Question, comment? Senator?
So, your current mission, over the 46 county veterans officers, how many employees do you have to oversee your current mission?
Not counting the county offices
Yeah, not
and the
counting
staff
the county,
themselves, my current FTE is relatively small, about 27.
And is there some efficiency to be gained by moving this from the Department of Mental Health? I mean, is there, you refer to them as the experts right now. They've been doing our veterans homes for ever since we've
Since
had
the
them.
inception.
Right. And are you aware of any problem that they've had in administering this part of their program?
They had a hiccup a couple years ago in Walterboro, the Veterans Victory Home. Again, that's a contract administrator, so there's really only one DMH employee there versus contract administration. They were cited, quite frankly, for some deficiencies. Those have all been corrected. Stone Pavilion, which is the only one actually administered daily by state employees to DMH, is a consistent 5-star rating. I think, again, if we were to pursue this, the likely way to do this is us contract with DMH back with those same people doing the same job, and therefore have no diminishing service.
Well, I mean, I know because I've met with you several times out in my counties that you have undertaken, I think, a tremendous mission to try and upgrade our delivery of services back in the counties. And I guess my question is, are we going to diminish your mission of doing that if we all of a sudden hand you nursing homes that you, in essence, I'm not saying you don't know anything about it, but I mean, it's really hadn't been your mission this whole time, and all of a sudden we're taking some fairly complex thing that you're already saying, first thing you need is a lawyer. Anytime you say the first thing you need is a lawyer, I'm thinking it.
Lawyer's the first one to tell you that.
I'm not an attorney, but.
Not an attorney, but he knows when he needs one. You know, this whole idea of restructuring is to bring efficiencies, to align things that should be aligned, and I understand you say that in some states they align it this way, but I guess in other states they align it the way we currently align it. Is that correct?
Well, not veterans nursing homes. We're the only state that's different.
We're the only one that's different. Okay. So this would bring us into the norm of how nursing homes generally are. They're generally under a veteran services.
Yes, sir.
It would just be new for us.
It would be new for us.
Okay. And in talking to Department of Mental Health, is it anticipated that if we made this switch that you'd actually bring over some of their current, so that when you say your budget would go up by X amount, their budget would correspondingly go down by some amount or not necessarily?
Yes, sir. Theirs would go down in terms of those people we would bring over with that level of expertise. Many of those other things, like in the inspection and oversight piece, that resides in DMH right now. The difference, I think, is, as Dr. Rogers laid out last week, is that they have one person who does it, not just for veteran nursing homes, for example, that might cover a residential treatment facility in Anderson.
All right. So we actually may have to either have to contract back with them to let that person continue to do that, or you're going to actually add a new FTE to solely be focused on the veterans homes.
And from my perspective today, I would offer the latter is probably the better course of action. That I bring somebody on who's specifically oriented on veterans. As we add 2 more this summer, potentially 3 more here in the out years, which means by 2030 we could have 8 or thereabouts. And the environment, by the way, fiscally with the federal government is very ripe for this. So we have an opportunity to strike here pretty quickly based on available federal monies. I think it's better to bring that in as opposed to trying to reach back into DMH, because their vision is naturally going to be bifurcated in multiple directions. And I think we can gain some efficiencies. So where we do look for efficiencies, so by bringing additional legal capability, public information technology, while I'm talking about those within the purview of this veterans nursing homes, in fact, that covers the broad department. So that actually enhances what we're trying to accomplish for the delivery of services to all 406,000 plus veterans and their family members.
Let me ask you one thing. Right now, 100% of your focus is on your current mission. If we give you this new mission, does that make your focus kind of a 50-50, or is this so much bigger than what you currently do that all of a sudden you're like 80 on the nursing homes and 20 on what you've been doing?
Well, I think I don't know this, but I'm pretty good at handling multiple tasks simultaneously. I think that on any given day, a lot of my time will be spent on nursing homes, and certainly in the early days to get this done right, to make sure that we're doing it right, I will probably spend a lot of my personal and professional energy on this, just to make sure it's right. The beauty in all this, as you heard my sister, I didn't know I had Sarah Goldsby talk about partnerships with state agencies. What I have found from day one here is that the relationship amongst us is very strong and easy to facilitate. And so the relationship that I have with DMH, I think will be able to be sustained to really bring us aboard correctly. Again, presuming we don't rush into this. So if we were to start at the beginning of next fiscal year, 2 fiscal years now, FY '23, then or later, then certainly we could do that.
Well, when you're up and running, and I don't know if you can envision that part, but let's say this happened and you're up and running, and 5 years from now, would you be spending 50% of your time, still be more on the nursing homes,
No, sir.
less on the nursing homes?
Well, I'll just put it in, and I'm not a numbers guy, but I'll put it in sheer numbers. On our best day, if we have 8 nursing homes in the current configuration, that'll be just slightly north of 1,000 veterans. If I got 406,000 veterans that I'm responsible, back to you and the governor and the state of South Carolina for, I'm gonna separate my personal direction very closely in the direction of continuing to care for everybody at the equitable levels. But I think we need to look at that, really focusing on the bigger picture of the broader population. The trick to that, though, is hiring the right people to actually do this administration and oversight. And again, I think we have that human capital talent pool right here in South Carolina that's able to do that.
Thanks, Jim.
Thank you. Alexander.
Thank you. Good morning.
So, that's it.
Thank you for what you're doing for our veterans across the state of South Carolina, and your leadership and your willingness to take on the veterans nursing homes. If I heard you correctly, all except for the V here in Columbia are contracted services now.
Right. So
Would you envision continuing to do that?
I think that's the appropriate way to do this. That gets people who are in this industry, very well proven, tried and tested, and are able to take this mission on. The way to do it correctly, like using any contract though, is the one state employee, right now DMH, that is in the other 2, in Walterboro and Anderson, and soon will be in Gaffney and Florence, is to make sure you have that right person that understands that their loyalty is back to the residents and veterans themselves, their family members, through the state agency, and they don't get, for lack of a better term, sort of captive in the environment where they work, which is all everybody else in that population of the contractors. So the oversight of this is very important. It has to be a standalone, high standard person.
And I guess my next question would be, considering if you're contracting for those services and that's the way it's being done now, and I fully support, I think it's worked well, do you still feel like you will need all those additional FTEs to?
I do. And I say that only because none of this capability resides. So if you look inside DMH and just the billing and accounting piece, contract management alone piece is pretty large. Now they do that for all of the other residential capabilities that they provide. We don't have any of that capability. I think that this is a pretty important.
So would that not be another avenue that you could also contract back? I mean, if it's working, you would be wanting to stand up a whole new finance operation.
Yes, sir. I suppose I could. And I'm happy to have that dialogue with DMH. As I said, we're in that pretty regular consultation with them now. If they were willing to do that can be somewhat of a burden on them.
But they're doing it now, right?
They are. And about to add more.
I mean, to me, seeing the veterans nursing homes go to the Department of Veterans is for the veterans to know where to go for assistance or one-stop shop, right?
Yes.
Rather than so much the operation of the nursing homes from that standpoint.
True. That's certainly an avenue I'm happy to explore if DMH were ready. And I will tell you, it's an interesting point, Frank. There is a fair amount of confusion in the veteran population when you start talking to them about long-term care and the options of a state veteran nursing home, and then they start asking questions. You say, well, yeah, I can only speak this deep on it. You really need to go to the Department of Mental Health about that. And some of our veterans, quite frankly, find that a little off-putting.
Well, if I couldn't
Sure.
Mr. President. I mean, again, you pointed out, and it was last week, and in my experience in working with them, I mean, the reason this is the Department of Mental Health is because of their experience in running hospitals. And under former health, mental health director John McGill, the first thing he did was take down the signs in front of the veterans nursing homes that said Department of Mental Health.
Yes, sir, that's right.
So, I mean, I think that, but I could understand the concern, and so I think that's another thing that really makes it special to me, that we would take the veterans nursing homes and put them with the Department of Veterans.
And I've spoken with John about this at length many times, so we've
First and foremost, we want to take care of Miss South Carolina.
absolutely.
Thank you, Mr. President.
Sister Sin.
So thank you. I think what I'm hearing, that you said that you're aware of only one hiccup. I know you're relatively new, but I'm sure you've done your research. And how many years was that?
That was, I think, 2018, as I recall,
Okay,
the year.
so it sounds to me like it ain't broke.
It's not. And I will tell you, Senator, the very first meeting, sorry, that's not true. The second meeting I did when I arrived here 14 months ago, I went to the Department of Mental Health to just learn about the services they provide and how we could collaborate, especially on the suicide prevention and other things. And one of my questions was, why are you running nursing homes and not me? And they laid it all out for me, and it made perfect sense. And then as I started traversing around the state and talking to people, I realized it works pretty well.
And then, so to bring it under the Department of Veteran Affairs, so I think you're telling us we would have to necessarily duplicate services, whether that's billing, legal, that kind of stuff.
That's my start position. I think that's correct. However, for Senator Alexander's point, I think there's always room for figuring out efficiencies, and I'm happy to do any of that.
Thank
you. Anyone else? Thanks, sir.
Yes, sir. Thank you.
Please, sir, lead us today. Members feel like we need to meet again in the interim, receive further testimony. I know Senator Johnson has some constituents we heard. I want everyone to be heard. And matter of fact, we have a few minutes. Anyone in the audience would like to speak on the bill? I'll take my chance not doing that.
Here's something you don't want to hear.
Yeah, that's right. Well, if there's no objection, members, subcommittee, full committee meets tomorrow, and after, it may be a little premature, but the gentleman said rushing in the wrong direction. We don't want to be rushing in the wrong direction. I want everyone to be heard, wants to be heard. There's no objection, we'll meet again,
You call in the interim
you.
this summer?
Maybe June,
Okay.
not May.
All right.
June.
All right, thank you.
Sometime after next week.
Anytime after next week,
Stand adjourned.
Great vacation.
Medical affairs today. All done.